back to our YouTube channel. In case you don't already know, my name is Sonia Cotto. I'm a nurse anesthesiologist and co-founder of Ketamine Clinic, South Florida. I wanted to make a YouTube video on one of my personal favorite topics regarding managing your mental health, the importance of journaling. In this video, I'm going to outline 3 prompts to help you in your journaling. These are prompts that I use for my patients during their ketamine infusions. However, these prompts can be used for anyone, even if you're not undergoing therapy. The first prompt I want to discuss with you is about finding your passion in your next career path if you're still searching. This is very important to everyone. If you are passionate and love what you're doing, you're never going to work a day in your life. The key is to really find what that is. And these questions that you'll answer will help you get there, okay? The first question you want to ask yourself is, what are you good at? What am I good at? It could be simple as I'm good at playing video games. I'm good at putting makeup on. I'm good at cleaning. Am I good at teaching, tutoring? I personally am good at teaching and I'm good at tutoring. So that's something that is always on my list. And I'm good at helping others. The second question is, what do I love doing? This is something that you are passionate about. You enjoy doing it. You aren't struggling to work. You know, when you're doing it, you're having fun. And if you can list off those things, even if it's simple, you know, if you love playing video games, put it on there. Last question is to look at things that you can make money from. What are the things that you could do right now that you could make money? When you take that list and you look at, what am I good at? What do I love doing? And what could I make money from? You're going to be able to see some similarities on each list. Now, if you have something on your list that you love doing and there's a way for you to make money from it, however, you may not be good at it, don't let that stop you from choosing it, because there are so many ways that you can learn to be good at it. It just needs practice. I myself, you know, didn't used to be a good student, but I learned how to learn. I didn't used to be good at IVs, but I did so many. Now I can do it almost with my eyes closed or even in the dark. I definitely suggest going into that list and just brainstorming, brain dumping as much as you can. Okay. The next prompt that I will focus on really is about tackling those fears, tackling anxieties. You know, a lot of times we have a difficult time going to bed, or we wake up with anxiety, and it's because of the thoughts that we're anxious about going to bed, and we dream about it. You know, if we can get it out on paper, it gets it out of our head. And this prompt is very, very important. This prompt is divided into 4 questions or 4 sections. So the first question is, what am I anxious about? What am I fearful of? Why am I so stressed or having anxious thoughts? You know, just list it all out. What could you possibly stress about? Work, school, kids, things you have to do. You know, maybe it's just a to-do list and you just list it all off. Things that you could be fearful of. You know, a lot of patients or a lot of people may be fearful of flying, traveling, going into social settings, you know, and you just list it off, you know, just brain dump it onto a piece of paper. The second question seems a little counterintuitive initially, but it'll make sense in a second. From that list that you made on the first question of what you're fearful and anxious of, I want you to go there, and on each item, I want you to write down, what is the worst thing that could possibly happen? Being counterintuitive, yes. However, when you don't have it on a piece of paper, you are already feeling the worst thing that could possibly happen, right? It's already in you subconsciously. That's why we're so anxious. We're feeling the worst thing. When you put it on paper and you actually see the worst thing that could possibly happen, you actually look and say, is that even possible? Am I really going to die if I go on a plane? Am I really going to fall flat on my face if I go out into a social setting? Or am I really going to kill my child? Am I really going to, you know, fill in the blank, right? The actual possibility of the worst thing happening is very, very rare. And putting it on paper and visually seeing it outside of your head will allow you to see that
And even that sometimes allows some of the anxieties and the fears to subside. The next prompt, question number 3. What is the best thing that could possibly happen? This is your opportunity to imagine what is possible. You know, you have a fear of flying, you're terrified. The worst thing that could happen is you falling out of the sky and dying. But what's the best thing? You going on that trip, having the most amazing experience, meeting your future partner, meeting your future best friend, finding another opportunity, anything could possibly happen. This is your opportunity to imagine, right? This is your power to create your future. Imagining what's possible is what creates that energy for you to have it be possible in reality, right? Nothing ever happens that you haven't thought of first. Our minds are so powerful, and until you imagine the best or what you really want, it's not possible. The shirt you're wearing, the shirt I'm wearing, for example, it was in someone's head before it was designed, before it was created. Nothing exists in our life that wasn't thought of first. So you have to think of what is the best thing that could possibly happen, and it could possibly be that. And even if it isn't that is the outcome, it certainly isn't going to be the worst thing. So it's going to be somewhere in between, but putting it out on paper allows you to actually look at it as opposed to subconsciously feeling the worst thing possible. The last question, and this is something and almost an action step for this prompt, is what can I take? What action can I do that would actually help? What action can I take right now that will make me feel better of the concerns, fears, anxieties from list number 1, right? Is it an action step? For example, oh, I'm stressed about this presentation. Well, is there something that you could do about that presentation that would make you feel better at that moment? Is there something about fear of flying that you could do? Probably not, but there's action steps that you can take, and writing it down creates a to-do list for later and at least gets it out of the head, making you feel better. The other thing you could do, if there is no action for it, is just starting to do different things to be, let's say, grateful, practicing gratitude of the things that you do have. We're so stressed and fearful of other things in our life. We're in this world of without, that we're always trying to find other things, that if we go back and are simple and just be grateful for what we have. Simple things like, I always say, my pillow, because I love my pillow now. I used to have horrible neck pain and I have no neck pain. Comfortable bed, your dogs, a home. Do you have air conditioning? Do you know how half the planet doesn't have air conditioning? And I can't even imagine living in Florida without air conditioning. Simple things like that makes you really appreciate what you do have, and then I guess not focus on what you don't have or what you lack, because we are in a world where everything is shown to us of what we're lacking. And if we buy this or buy that, then we'll be happy. And that's not true, because we could be happy with everything that we have if we weren't shown everything that we don't. So just take a step back and just appreciate the little things that you have.
Journaling has not only helped me in my personal life, but also in my professional life. And it has immensely helped my patients here at Ketamine Infusion Clinic of South Florida. Thank you so much for your ongoing support, and please, subscribe and stay tuned for our next video. This is Sonia Cotto, and I'm signing off. Have a great night.